our course. Today's topic is pharmaceutical liquid dosage form. As name indicates, they are liquids in nature. So, in this chapter, we will learn about what are liquid dosage form, how they classify, and different type of liquid dosage form available in market. So, let's start with chapter number 5, liquid dosage form.
So students, come with the next topic, pharmaceutical liquid dosage form, lesson number 5. So what are the pharmaceutical dosage form? Pharmaceutical dosage form determine the physical form of the final pharmaceutical preparation. It is a drug delivery system which is formed either by technological processing, drug formation, and must reflect therapeutic intentions, route of administration, and dosing, etc. Pharmaceutical dosage form included active substances and excipient, which is converted into the specific dosage form which accept a specific route of administration. Active substances, active pharmaceutical ingredients, and chemical compound which pharmacological intended for use in diagnose, treatment, and prophylaxis of disease. Excipients, these are inactive pharmaceutical components. Its selection depends on technological, biopharmaceutical, or stability reason. Some excipients used in preparation of pharmaceutical dosage form are coloring agent, sweetening agent, flavoring agent, surfactant, solubilizing agent, antioxidants, preservative, thickening agent, suspending agent, binding agent, solvents, lubricants, perfumes, fats, and oils. Now, liquid dosage form. Liquid dosage form are the pharmaceutical dosage form that are designed to provide maximum therapeutic response in population with difficulty of swallowing of tablets or capsule or to produce rapid therapeutic response. Water is the major components of these type of dosage form. Maintenance of both physical and chemical stability of formulation is the main challenge in these type of dosage form. So based on the physical characteristic, the liquid dosage form is divided into the solution and dispersion system. Advantages of liquid dosage forms are they are more effective than solid dosage form as this eliminates the dissolution step of solid dosage form. It is easy to swallow than solid dosage form, especially in ease of gastric and pediatric populations. Certain drugs have to be administered in liquid form only. It may be due to the large dose of drug that is difficult to administer in solid dosage form, and some drugs which cause gastric irritation when administered in solid dosage form like potassium iodide and bromide, they are converted into liquid dosage form or administered in liquid dosage form. But there are some disadvantages also here. They undergo deterioration and loss of potency more frequently than solid dosage form. They show more flavoring and sweetening problems. Many incompatibility problems occur between the dissolving ingredient or dosage form. More chances for microbial contamination of the product as water is used as a main solvent, so preservative may added. Inaccuracy of measuring the dose, and they are bulkier to carry than solid dosage form. Now, types of liquid dosage form available in market. The first one is solution. Solutions are liquid dosage form, or we can say monophasic liquid dosage form, in which solute completely dissolve into a solvent and form homogeneous mixture. The types of solution: number first, syrup. Syrup is or syrups are concentrated oral solution of sugar or nearly saturated solution of sucrose in water or other aqueous liquid. Syrup containing 85% weight upon volume or 66.7% weight upon volume sucrose will retard the growth of microorganisms. So syrups are concentrated aqueous preparation of sugar or sugar substances with or without flavoring agent and medical substances. There are mainly two types of syrup available in market, or one or also added, we can say three types of syrup available in market. Simple syrup, it contains sucrose in purified water alone or in combination of other polyols such as glycerin or sorbitol. These substances are added in syrup to reduce the crystallization of sucrose or improve the solubility of excipient. Number second, medicated syrup. It contains some added medicinal substances in the syrup and used for therapeutic purpose. Third one is flavored syrup. It contains various aromatic or pleasantly flavored substances but are non-medicated and generally used as a vehicle or a flavoring agent for the preservation. Next one is linctus. Linctus are viscous, sweet, liquid oral preparation that are usually prescribed for the relief of cold. They consist of simple solution or admixture containing a high amount of syrup and sometimes glycerin with in addition to giving sweet taste to the preparation, have a demulcent action on the mucous membrane of the throat. For best result, linctus should be used without dilution and sipped and swallowed slowly to ensure prolonged contact with the mucous membrane of throat. Best example of linctus is codeine linctus and tolu linctus. Next is aromatic water. Aromatic water are saturated aqueous solution of volatile oils or other aromatic or volatile substances. Example, camphor water, concentrated peppermint water. They are mainly used as a flavoring agent. They are prepared by distillation, solution method and alternate solution method. Next is elixirs. Elixirs are clear flavored hydroalcoholic preparation intended for oral use. They contain one or more medicament, pleasantly flavored, usually attractively colored, containing high proportion of alcohol or sucrose along with some suitable antimicrobial agent. So, elixir are clear, liquid, oral, alcoholic solution contain potent nauseous drug which are plentifully flavored and use attractive color. They are more stable than a mixture. Classification: non-medicated elixirs and medicated elixirs. Next is tinctures. Tinctures are sweet, viscous, liquid oral preparation containing medical substances which have demulcent, sedatives, expectorant preparations. The simple solution or administration containing a high proportion of syrup and glycerin have a demulcent effect on the mucous membrane of the throat. They are an alcoholic or hydroalcoholic solution of chemicals or soluble constituents of crude drugs. The tinctures contain 20 to 90% of alcohol and spirit containing volatile substances only. They are prepared by simple dilution, maceration and percolation. Now, vaginal douches and enema. Enema are aqueous or oily solution or suspension or oil in water emulsion introduced into the rectum or colon for cleansing, administration of nutrient substances, medicinal substances, and opaque material for radiological examination of lower intestinal tract. Enemas are mostly used for the following reason: to relieve symptoms of constipation, to cleanse the rectum and lower intestine in preparation for examination, to remove feces to prevent contamination during a surgical process, or to administer anesthetic drug to a patient. Now gargles. Gargles are an aqueous solution used to prevent or treat the infections in throat and gums. They are usually available in concentrated form with direction for dilution with warm water before use. They are brought into the intimate contact with the mucous membrane of the throat and allowed to remain in contact with it for a few seconds before they are thrown out of the mouth. Phenol or thymol may be the present in low concentration, which exert a mild anesthetic effect. Next one is mouthwash. Mouthwashes are aqueous solution containing one or more active ingredient for use in contact with the mucous membrane of oral cavity, usually after dilution with warm water. They contain additives such as alcohol, glycerin, synthetic sweeteners, surfactants, flavoring and coloring agent. They are used for cleansing, refreshing, deodorizing and antiseptic action of for mouth cavity. They may be either acidic or basic in nature, and some instant are fairly effective in reducing bacterial concentration and odor in the mouth for short period of time. Next, emulsion. Emulsions are biphasic liquid dosage form in which two or more immiscible liquids are made miscible by the third agent called emulsifying agents, and they are of two types: oil in water and water in oil. So emulsion is a thermodynamically unstable liquid preparation containing at least two immiscible liquids in which one liquid phase is dispersed as a globule in another liquid phase and stabilized with the aid of an emulsifying agent. And suspensions are finely divided. Suspension are biphasic liquid dosage form in which finely divided solid particles are dispersed uniformly in liquid dispersion medium. So we can say suspension when solute is immiscible in solvent and we make them miscible by adding a suspending agent. The formulation prepared is called suspension. Now lotions. Lotions are usually liquid or liquid suspension or semi-solid preparation containing one or more medicament intended to be applied into the uniform skin without friction. They are lightly applied on the skin or applied on a suitable dressing and covered with waterproof substances like glycerin to reduce evaporation. They may be prepared by titration the ingredient to a smooth paste and then gradually added the remaining liquid phase. Lotions are generally prescribed for the following purpose: anesthetic, antiseptic, astringent, germicide, protective, antihistaminic. Next one is liniment. Liniments are solution or mixture of various substances in oil, alcoholic solution of soap or emulsions, or occasionally semi-solid preparation intended for external application and should be labeled for external use only. They are liquid or semi-liquid preparation meant for application to unbroken skin by friction or applied on lint or other suitable material and placed on affected part. They may be alcoholic or oily or soapy solution or emulsion. Alcoholic liniment are used generally for their rubefacient, counter-irritant and mildly astringent and penetrating effect. The oily or soapy liniments are milder in their action but are more useful when massage is required. Liniment should never be applied to the broken skin. Best example of liniment is camphor liniment and turpentine liniment. Thanks. This is all about liquid dosage form.
So dear all, I hope you understand about liquid dosage form, how they classified, and which type of formulation or which type of liquid formulation available in pharmaceutical market. So soon we will be back with our new chapter, chapter number 6, which is pharmaceutical semi-solid dosage form. Till then, bye, take care and keep learning. Thank you.